Okay. Hello, everybody, and welcome to our second health and wellbeing talk. And this morning, I am delighted to be joined by Caroline Kennedy, one of our nurses from our student health services, and also by Alicia Molyneux, who works for the Maire Keating Foundation. And Alicia is a community information nurse. So I'm delighted that the two of you could actually join me this morning in talking about, I suppose, the Maire Keating Foundation, and also talking, I suppose, very in an open and an honest way about cancer. So I'm going to hand over to Caroline, who I bow down and say is an expert on this. So I'm going to hand over to Caroline for now and let you two talk, okay?
Great, thanks, Yvonne. And hi, Alicia, and thank you for taking the time to do this talk with us today. So, Alicia, I know that Maire Keating Foundation have been supporting the college here for a number of years and come and do education and health promotion. So can you just tell us a little bit about what Maire Keating do and what services they provide?
Yeah, absolutely. So the Maire Keating Foundation, we've actually been around since 1998, and what we do is we offer awareness and educational programs on the most common cancers here in Ireland. So we do that by going out to ITs, we go out to schools, and we go out to corporations. As well, we do have some services and workshops for those. We have a Survive and Thrive workshop, and they're for people who have survived cancer, and it's kind of helping them get back to the new normal. We hear about the new normal when it comes to COVID-19. It's the same with someone that's been diagnosed with cancer. So it's to help them kind of get back into their new normal, helping them get back into work and things like that after a cancer diagnosis. We also do positive living, so that is a meeting for women and men with advanced metastatic cancer, and that is just a support group for those. They're all kind of in the same boat. They have their diagnosis. They're not going to be cured from it, but they do have support there throughout their journey. We do things like a BRCA support group as well, and we do social inclusion talks. So at the minute we're talking with the Syrian refugees and with the travelling community, and we also do podcasts. So at the minute we're working on a lung cancer podcast as well, and we had a melanoma podcast during the summer. So they're all kind of things that we do within the Maire Keating Foundation.
It's fabulous, and it's so great to have the supports, and especially for survivors of cancer, to have support groups and people to talk to, and people that are experienced and know the information to give people, so that's great. And we're delighted here. We get great feedback every year when Maire Keating visits the institute, so thank you for that. And I know on the other side of it, the statistics of 1 in 2 people in Ireland will develop cancer at some stage, and that is very worrying. But there are lots of small steps that we can all take to reduce our cancer risk. And I know you mentioned some of those to me earlier.
Yeah, absolutely. It is unfortunately quite a significant statistic, and unfortunately it does. Cancer is now the #1 cause of death here in Ireland. It used to be heart disease, but with early detection and early treatment, a lot more people are surviving. But a lot of people don't realise that they can actually reduce their risk of up to 40% of cancers just by making healthy lifestyle choices. So things like smoking, we know 1 in 2 smokers will die of a smoking related disease. It causes 90% of lung cancers, but it can also cause 30% of overall cancers in Ireland as well. So cancer of the larynx, bladder, esophagus, pancreas, throat. And we do know it takes 10 to 15 quality years off a person's life. And the reason for that, there's over 4,000 chemicals in every cigarette and 69 known cancer-causing carcinogenic chemicals. And it's never, ever, ever too late to quit. So there's loads of resources out there for people that do want to quit, or that know someone that wants to quit. There's support there as well. Another thing as well, weight and diet. Over 40% of Irish population is considered overweight or obese, and that is estimated to go quite high, up to over 85% by 2030. And being overweight can cause cancers of the breast and the bowel, and specifically diets high in salt, sugar, fat and highly processed foods and meat would be at the highest risk of cancer. So just making sure that you are maintaining a healthy weight, eating a healthy diet. We don't fall into these fad diets or anything like that. It's just being smart with what you're taking in. So obviously plenty of fruit and vegetables and food low in salt, sugar and fat. The next thing that people can do is exercise. It's recommended that adults should get about 30 minutes per day or 150 minutes per week of exercise, moderate to vigorous intensity, as well, making sure you're doing exercises that work on the muscles and on the joints as well. And exercise can reduce your risk of breast cancer, bowel cancer, and cervical cancer. And the reason for this is exercise as well regulates the hormones. And again, obviously not exercising can increase your risk of being overweight, which then in turn can increase your risk of cancer. The next thing people can do is be sun smart. Obviously now we're in November, we don't concern ourselves too much with the sun, but especially between April and September, making sure you're looking after your skin. So making sure minimum SPF 30 every single day you're going to be outside in the sun, checking the UV index. Maire releases it every single day, so just checking it. If it's in the green, you're safe enough. If it's anything outside of that, you need to be wearing your sunscreen. You should be making sure that you're wearing wide brimmed hat to cover your face, your ears and your neck, because that's the most exposed to UV lights throughout the year. So you should be making sure that you especially put SPF on your face, and wearing long sleeve clothing, avoiding being outside in the sun between 11 AM and 3 PM when the UV rays are at their highest, and wearing sunglasses as well that has SPF protection. A lot of them don't, and a lot of people will get skin cancer around the eyes because they don't put the SPF around the eyes. Alcohol then as well, obviously reducing your alcohol. Alcohol is linked to many cancers. 900 people die every year from alcohol related illnesses, and it can cause cancer of the breast, mouth and liver. And specifically for women, there is a 9% increased risk of breast cancer with every standard drink that you drink every day. So don't binge drink. We all hear about binge drinking. Unfortunately, Ireland ranks 5th in the world for binge drinking out of 195 countries. So it's just remembering, know the standard unit. Standard unit is a half pint or 100 ml glass of wine. So it's actually very small. And when we talk about a binge, we're saying 6 standard drinks or more in one sitting. So if you're drinking beers, you know, a half pint is a standard drink, which means that 3 full pints is already a binge. So it's just being mindful of that when you are going drinking. Then as well, there's vaccines. The HPV vaccine, if it becomes available to you, obviously your students will be much too old, but it is available up to the age of 26. And then screening services as well. Again, a lot of your students will be too young for that, but just keeping in mind that those screening services are there and encouraging them to go and get those screenings.
And well, we have a lot of staff members also who are possibly in a different age group, you know, than the students and the screening. You know, I know there's a lot of screening out there. So what kind of screening measures would possibly, you know, apply to our staff and our students?
So we've 3 screening services here in Ireland, and they're all free, and they're to look for cancer at its earliest stages in people that don't have any symptoms whatsoever. Obviously, if you have symptoms, you need to be going to your GP. So we're looking for it at its most earliest stage, when it's more likely to be caught early and treated and cured. So the 3 that we have here in Ireland, we have bowel screening, and that is available for the ages 60 to 69, and that's both men and women. And that is a pack that you'll get every 2 years. You take a small sample of your stool. It's checked for minute traces of blood, which can be a sign of bowel cancer. So that's available between the ages of 60 and 69. We have breast cancer then is another screening service, Breast Check. That is for women aged between 50 and 69, and that is a mammogram every 2 years. And then we have cervical screening. It's been changed from the smear to now the HPV cervical check. And what we do is we look for HPV first, rather than looking for abnormal cells, because abnormal cells can be caused by anything and they can go back themselves. But we do know that HPV causes 99% of cervical cancers, so that's why we look for that first. So that's available between the ages of 25 and 65. So younger women as well as older women should be going for their cervical screening, and they should be making sure they're registered as well. It is absolutely free. It should be automatic, but people can slip between the cracks as well, changing names, changing addresses and stuff. So if you go onto those websites, the cervical check website, breast check website, or bowel screen website, and just make sure that you are registered for it, you will automatically get an appointment sent out.
Okay, and so your GP can advise as well, or for the cervical check, you can just attend any GP that's involved in the programme and you'll get a free smear. So I know that we get questions about that quite often. And all the other factors that you discussed, you know, reducing alcohol and increasing our exercise. I saw in some of the literature that vacuuming is one of the things that's considered to be good exercise. So yeah. We won't mention that too loudly. We'll go for the walks instead. But we do encourage our students, and I know at this time of year for the staff and students, it's difficult when it gets dark early and it's hard to get out, but I think, you know, maybe being part of a group, a walking group, having a couple of friends, and, you know, if today you don't feel like going, some of the gang will say, come on, look, let's just get out, get the high vis on and get out. And I know that Yvonne had organised the Walktober. We took part in that here for October, so it was great. It really encourages you to get out and about and get your exercise, get your steps up each day. So we try and involve the staff and students in these kind of initiatives, you know.
Yeah,
and just with the smoking reduction, we do, I know you mentioned that there's lots of support there, and we do have a smoking cessation facility or service, and we can refer out to the HSE smoking cessation service. And we have support for students and staff who are taking part in that. And we have some funding for nicotine replacement therapy to encourage them to get started. So it's great, you know, not just, you know, mainly student health, we deal with the students, but this is also extended to the staff, so it's a great incentive for people to, you know, if they've been thinking about it, maybe to just you know, get on board and get help with quitting, you know. And we also work with the Students' Union. So the Students' Union here are great with regard to alcohol and drugs and various things like that, you know, initiatives. So a lot of work goes on, and we work with them closely on you know, informing students about the risks of binge drinking and that, you know.
Yeah, fantastic. It's great facility to have.
So the early detection and screening and the vaccinations, I know, for our cervical check. And Yvonne, I know we organised this event because it was November is Men's Health Awareness, and we were trying to encourage awareness of that. So Yvonne, that's why we had talked about organising this event.
Yeah, I think they kind of coinciding with International Men's Day on the 19th of November. And that's why we've invited you guys to campus. So you're going to be on campus with us next week, or it'll actually be this week when this goes out to people. So you're going to be on campus on Wednesday, the 17th, from 10:30 to 3:30. People will know you because you'll be parked right outside the front. And your van is very recognizable. So people are welcome to drop in and talk in person if they want. We also hope to have an information stand just outside the canteen at lunchtime. But I think it's back to that kind of like it, you know, the importance. Everybody, obviously, men's health and women's health are so important. But I do think men are more reluctant to come forward and say, you know, I'm having this issue. I'd like to get it checked out. And like we have quite a big demographic on campus. So we have, you know, the young lads coming onto campus, and then we have mature students, and then obviously our staff demographic can vary from 25 up to retirement age. So obviously getting men to step up and come forward, and you have a really good program called Get Men Talking. So could you chat to us a little bit more about that?
Yeah, so like you said, men statistically are less likely to go to their GPs and more likely to be quite sick and quite severely sick because they leave it so late to go and get things checked out. So this is especially during June as well, which is Men's Health Week as well in June. And obviously this month is November for Men's Health. So it's just to encourage men to get themselves checked. Everyone needs to be going in to their GPs, regardless of age, just to be sure that there's nothing going on. Women are great for going in if they're sick or if they're poorly, and they're very good as well as looking after other people. Men tend to just want to, you know, forget about it. It's not there, it's not happening. I can look after myself. No one needs to know. And there's an embarrassment as well when it comes to going to the GP or speaking about their health. So it's just to encourage men to speak out. They don't have to go to their GP, maybe even talk to their friends, talk to their family, and even they might be able to encourage them to go to the GP if they do feel like something is going on. So it's just as well to make them aware of all of the resources out there for them too, when it comes to physical health and when it comes to mental health as well. So we're very much about getting men talking, because like that, men unfortunately do die younger as well when it comes to kind of more severe illnesses in later life, and they have a lower quality of life as well in the last few years, purely because they're less likely to go in and get themselves checked.
And what should young men be looking out for, really? This is for either Caroline or Alicia, in relation, say, to testicular cancer, which, it does affect a lot of young men. And, I've had friends diagnosed early and thankfully cured and getting on with their lives. So what should young men be looking out for?
So yeah, like you said, testicular cancer is unfortunately a young man's cancer. The ages between 15 and 34 are the high risk. So that's very, very young in young men to be getting testicular cancer. But like you said, it's very much curable. It has a 97% cure rate. So very much once it's caught early, it is absolutely curable. So men just need to get to know their testicles. Basically, they should be doing checking their testicles at least once a month. And doing it in the shower, because then their scrotum is nice and relaxed. All the muscles are relaxed and it's more likely they'll be able to feel anything that's not supposed to be there, basically. So they need to be looking at the testicles and also feeling the testicles. So they need to look at the skin of the scrotum to see if there's anything there that shouldn't be, any redness, any dryness, any swelling. And as well, then they need to be looking and feeling the testicles. So it's very, very normal to have one testicle that hangs lower than the other, or one that's slightly bigger than the other. That's completely normal. What's not normal is any lumps or swelling in one or both testicles, any discomfort or pain in the testicles or in the scrotum, any increased firmness or feel to one or both of the testicles, any feeling of heaviness in the scrotum, any dull aches in the abdomen or in the groin area, any blood in the semen, or any lower back pain that won't go away. So these are all things that men need to become aware of. There should be no pain whatsoever when it comes to checking your testicles. So even if you cannot feel anything that shouldn't be there, if there is pain there in the testicles while you're doing this check, you still need to be going to your GP. And when it comes to changes as well, a lot of the time it's not anything that they need to worry about, but it's better safe than sorry. And there's an embarrassment as well of going in, and having a doctor checking your testicles. But the doctors are professionals, they see this every single day. They see worse than this every single day. There's nothing to be embarrassed about. They are absolutely professional about it. And it's better safe, even if it only puts your own mind at ease. It's better safe than sorry. And like I said, it does have a high cure rate. So even if it is testicular cancer, if it's caught early and treated early, more than likely it can be cured.
And I do think, Alicia, that's important. And we do have students who come in with testicular lumps or testicular pain, but often they've left it for a couple of days, or, it's been there for some time, a month or two, because they're embarrassed to come in and talk about it. So we do have a student health service here in IT Sligo. It's a full health service with GPs and nurses who are trained and have extensive experience in student health. And so we're delighted to see them, and we would encourage them not to put it off, not to be embarrassed for anybody. Just go to the GP, and once you go and see them and they reassure you that it's nothing to worry about, it's just a weight lifted off your shoulders. And like that, the earlier you pick up, if it is something more sinister, the earlier you pick it up, the better outcome. And we have referred lots of students out for specialist services, and mostly it's all fine. It's just benign or harmless, So I would encourage the students not to worry, not to be stressed, not to be putting it off every day and worrying about it. Just come into us and we'll sort it out,
Absolutely.
Yeah. And I suppose it is back to that knowing your own body and knowing what doesn't feel right, and if it doesn't feel right, do something about it. Yeah. And I suppose then on the other end of the Sorry, Karen, you
No.
go ahead.
I was even just exactly as you said there, even with regard to breast check, it's about getting to know your own breasts so that you can identify when there's something different or there's something, oh, I don't think I felt that before. And it may be absolutely nothing to worry about, but it's just being able to say, actually, I think that feels a little bit different. Maybe I'll get someone else to have a look. I'll go to the GP or I'll go to the nurse and I'll get it checked out. So sorry, Yvonne, I didn't mean to interrupt.
No, you're fine. And I suppose then the other end of the spectrum then, and the other most, I suppose, common cancer that I'm aware of with men is prostate cancer. And again, I suppose it's like there's none of us that doesn't know somebody that has had cancer or is going through cancer treatment at the moment. I don't think any family escapes it at the moment with the stats the way they are. So it's either somebody in your family or a best friend or whatever. So, but in relation to prostate cancer, how is that picked up? So what do you think to be looking out for?
Yeah, when it comes to prostate cancer, it is generally men over the age of 50 that will get it. So, but like that, you can get it at any age. In the early stages of prostate cancer, a lot of the time there are no symptoms whatsoever. So a good thing to know is if there is a family history there of prostate cancer, or if there is a family history of the mutated BRCA gene, you are at an increased risk of prostate cancer. So you should be getting tested earlier than 50. But for anyone that doesn't have that family history, getting tested after the age of 50 is generally fine. So the way that we do test for prostate cancer is a PSA test. The prostate produces this protein, and it can be tested in the blood. So it would be a PSA blood test, and as well a digital rectal exam to see if the prostate has swollen. So they'd be the ways that we test. There's no kind of standard screening, but that's how we do it here in Ireland at the minute. So like I said, a lot of the time there are no symptoms in the early stages, but some symptoms that can happen would be kind of passing urine more frequently, any difficulty in passing urine, either needing to rush the toilet, any bone or back pain, any lethargy, and any weight loss for no known reason, and being just kind of generally unwell. But like that, these symptoms are very similar to other kind of illnesses as well. So just because you have these symptoms doesn't mean it's prostate cancer. And the prostate generally doesn't become swollen enough to actually really cause issues with your waterworks. So the likelihood of these symptoms being prostate cancer is slim. But obviously, if you do have them, make sure that you go to your GP and let them know as well exactly all of your symptoms, so they can kind of rule out different things and possibly prostate cancer. But like that, if you do have a family history, they might do these kind of tests younger than the age of 50, and because like that, there is a possible chance that you could get prostate at a younger age, prostate cancer at a younger age.
And I know, Alicia, even, that PSA blood test can just be done with all the other routine blood tests. It's just a matter of adding it in. So somebody doesn't have to go specifically if they're over 50 and just having their cholesterol checked or just routine bloods. They can just ask the GP or the nurse, and they can just do it as part of the whole batch of routine tests.
They can, absolutely, yeah. What they've tried to move away from is including it under the age of 50, because what can happen is men are being overdiagnosed with prostate cancer, and the levels might not be significantly high in the blood test, so they don't have to technically go and get any treatment. Surveillance is usually good enough for the time being, but it has caused a lot of people to go through treatment that maybe necessarily they didn't need. So that's why we try not to test the PSA in anyone younger than 50 unless there's a strong family history there. Yeah, but absolutely, it's not something that you specifically have to go in to get. You can throw it in with all your routine bloods, and we always recommend people go in every 1 to 2 years just to get the full bloods done, just have a nice look at how they're getting on.
Great, that's great. That's great.
Yeah.
That's loads of really useful information.
Yeah, and I think it's kind of I wasn't aware really of the bowel screening when that kind of must have been somewhere out there on my radar. But if that's one thing that people can maybe take from this from talk is kind of maybe a to-do list of an NCT for yourself, depending on what age category you're in. So I went over the 50 category there last year. So, you know, obviously I've registered with Breast Check. We keep up with my smear tests as well. And so I think it's important that people are aware of that. And if that's even the only thing that we get out of like a talk like today and having you guys on campus on Wednesday, is just to bring that level of awareness that, you know, these checks and tests are here, and that you're not alone, and, you know, just go and do them, you know, just go in and get your bloods done, get a mini NCT or whatever done, and you could, you know, detect some of these things really early and get treatment really early.
Yeah, that's it. Exactly. What we want to do is just make people aware of the services out there. We want them as well just to become very, very familiar with their own bodies and listen to their bodies when it tells you something is wrong. 90% of the time, it's actually nothing, you know, it's nothing to worry about, but there is that 10%. And like we said, the earlier something is found, the earlier it can be treated, and the more likely that you can be cured from it. So it's just making people aware that services are out there if they need any kind of helping hand. And, you know, the majority of the time there's nothing to worry about. You will, of course, come across someone that has had cancer at some point in your life. But it's not a death sentence anymore. It's not a diagnosis that needs to be feared anymore. As long as you are mindful of your health and mindful of your body, there's nothing really to fear anymore.
Oh, that's good to hear. Caroline, do you want to signpost to some of your services that you have, or how the students can get in touch with you?
Yeah, so we're based in the Student Services building here, just in beside the Student Union and the Student Shop, and we have a full health service which is available from Monday to Friday, and it's a completely free service. So you can ring us or you can email us in for an appointment. We're doing in-person and virtual appointments depending on what the needs of the person is, and the service is completely free, which is absolutely brilliant. The students don't pay to see the nurse or the doctor. They can have as many appointments as are required, and we provide all the services that any GP provides. So it's great, and it's great for the students to have that. Now, just from the point of view of stress and anxiety, which is also, you know, affects your health, and we have a full counselling team here as well in the college, and the students exactly the same can just email in for an appointment or phone us, and they can have an appointment with one of our counsellors as well. We have a pastoral care team, so we have lots of services here, and we can refer out if something is identified that needs to be looked at further and needs specialist care. We can refer out to the hospital services or outpatients or whatever it might be for further, you know, we can refer to Breast Check. We can do all of those things here from the Student Health Centre.
Yeah, and it's like we are really, really lucky to have such a great service and a free service, and a wonderful team. And even in the post-COVID world, and even during COVID, you guys kept going, you know, the service was still there, albeit virtual. So I think it's important that people know that. And then obviously for staff, you know, they need to just go to their own GP, you know, follow up, and have the conversations, you know, over the cup of coffee or the cup of tea, you know, because that might be the first time that you've opened up about something, you know, that I have an ache or a pain here. What do you think? You know, and it might be just that conversation that gets you to go, yeah, you know what, I'll pop along to the doctor and make an appointment. Yeah. So just to remind people again, you will be on campus Wednesday the 17th. Looking forward to welcoming Alicia. Is it your first visit to Sligo?
It is my first, it is, yeah.
Oh, well, it's a beautiful campus, beautiful county, and we'll take care of you on the day. Thank you both for joining me today. Is there anything else that you want to add before we go?
No, I think that's everything. Yeah, if anybody needs any more information, we have our student health website on the IT Sligo page, and we've lots of information about health and well-being, you know, on that. And if somebody wanted to just email in there's links on the web page just to contact us, and our phone number is on it, our email is on it. So if anybody wants to even just put a query, they're just not sure if they need to be seen, just give us a call and we will be able to give them advice. So thank you, Alicia. Thanks so much for taking the time to speak to me today, and Yvonne, and thanks for organising, Yvonne.
No problem. We'll see you Wednesday.
Great. Thanks, Yvonne.
So much.